Welcome to the first episode of the IPSQ podcast series 1. I am Shao Chu, and today we are going to touch on quality improvement in healthcare and what it takes to be a quality improver. This is vital as healthcare takes on a continuous improvement culture to improve processes and outcomes for our patients. In the first part of this episode, we will walk the ground and hear from our peers at SGH campus on their thoughts about quality improvement. We also have a special guest with us in the second segment to share his or her thoughts on what a quality improver is and how to start your improvement journey.
I think it's just improving everything that is along the line of service delivery.
Quality improvement is, to me, means how do you actually find ways to make the existing processes better, more efficient, and then also maybe on the safety aspects wise.
I think it's a constant process of improving our processes and workflow and trying to find new ways to do things so that we don't waste resources in terms of time and money.
I would say quality improvement is going from a system where the system doesn't flow well or things are disrupted throughout it and improving the way things work and how everyone is organized and works together.
Less effort, more output.
Improving the quality of work processes that we have, either in a working administrative environment or even in the healthcare environment.
I think quality improvement is about when we are looking towards improving patient care and then looking at steps that we can help to reduce the time, maybe the wait time, etc. for them.
Improving the current standard we have and try to improve patient care or any form of care standard that we have that we can help to improve patient care.
It's quite scary. Have we not done good enough? I think there's always room for improvement.
It's actually quite a big word. Like I mentioned, it's actually on all different aspects. Usually people will only be focusing on their own particular domains. For example, if you ask me about QI for my AV, I can give you all the different answers and everything. But when it comes to maybe for patient safety, those things, then I will have a lot of difficulties trying to give you answers.
I feel that it's something worth doing. I feel it's an important aspect of any institution.
It's a really good thing and it will help us in the future, especially with organization and how we need to work together, also internationally as well as locally.
Well, I'll be able to spend more time on more meaningful work.
I feel it's good. That means there are things being done to improve the situation that we currently is.
I think it's a positive thing because when quality improvement means that we are actively taking steps to always help improve the type of feel that they will have when we come to the eye center.
It has to be a consistent effort from everybody, and it has to be. There's no end point to it. It has to be an effort, continuous and consistent effort that we have to take to improve patient care.
So here with me today is Dr. Teo Lee Meng from Sengkang Hospital. She is also one of the SingHealth Improvement Advisors. Hello, Dr. Teo. Welcome to the IPSQ podcast series 1, episode 1. It's wonderful to have you here in our first ever episode where we try to get a sensing on the ground to find out what our peers or colleagues feel about QI. Now, QI is such a popular topic in healthcare and in many industries, and you have heard the responses from the ground. I have the first question for you, Dr. Teo. As a QI guru, what do you think is most important to know or understand for someone who is new to quality improvement?
To someone new to QI, do not be intimidated by the terminologies you hear. Like our clinical work, these are just terms we use so that we're all on the same page. The methodologies in QI are a systematic approach to solving problems so as to make healthcare safe, efficient, patient-centered, timely and equitable. The methodologies help us think of aspects of a problem that we might not have considered. In QI, we are tackling problems. We observe something and then we think whether the current level is good enough. Let's say we notice that patients from the emergency department appear to be waiting rather long to get an outpatient appointment. What would be our purpose if we acted on this? I would think it would be more timely care for our patients. We then start to go through the methodology to carry out improvements to close the gaps.
Interesting when you mentioned that whether a current level is good enough, how do you establish a baseline? And who then is responsible to start the project?
Well, the current baseline can be determined by obtaining past data for the parameter we want to measure. Let's take the previous example I quoted about the ED patients waiting long for their outpatient appointments. We can collect how many days do ED patients with fractures wait to see an orthopedic doctor in SOC and get an average. We can then determine to what degree we want to reduce that wait time. Now, anyone and everyone can start a QI project. Quality improvement is not a quality engineer or a quality coach's job. It is everyone's responsibility. We are all in healthcare to take care of our patients and to bring about changes that benefit our patients. So everyone can be a quality improver.
Indeed, I can definitely resonate with that, and I'm sure many of us listening in have experienced some kind of difficulty in our work and we try to troubleshoot to make it work. How do you think one can be a quality improver?
My take is that QI shouldn't be a chore. Make it a point to cultivate it into your daily routines and habits. There are many tools and techniques that you can learn, and I would say the best start is to go for a QI course. Let the trainers take you through a systematic approach of doing a QI project. The QI project teaches you concepts on improvement and change management, tools to scope the project, uncover the root causes, generate ideas and pilot these ideas on a small scale, and from there learn from the pilot tests before spreading and sustaining the change. These are the key components that a quality improvement should learn before embarking on a QI project. And do not be afraid to fail. If one intervention does not work, you have your answer already that this problem cannot be solved by doing this. Try something else.
Wow, it sounds very comprehensive and might be intimidating for those new to QI. Will the novice quality improver obtain any assistance on this QI project journey?
Yes, not to worry. Approach the QI coaches or the QI departments in your organization. They are the ones who specialize in facilitating QI projects and are well versed in the concepts of QI and the QI tools. Remember, QI project is a team effort, so never hesitate to reach out and tap on available resources. And most of all, enjoy the process. QI can be fun.
Thank you very much, Dr. Teo, for spending your time with us today and sharing many insightful thoughts and tips. The Institute for Patient Safety and Quality has a suite of programs aimed at upskilling and uplifting the patient safety, quality and innovation capabilities of staff under the Academic Medicine, Enhancing Performance, Improving Care, in short AMEPIC framework. Do drop us an email at ipsqworkshop@singhealth.com.sg or visit our website at www.singhealthdonus.com.sg/IPSQ to find out more about our AMEPIC programs. If you enjoyed the podcast, do subscribe to us on your preferred podcast app and do give us a rating so that we too can continuously improve. Thank you for listening and see you on the next episode of IPSQ podcast series. Till then, this is Xiao Chu signing off.